Well, thanks for coming, folks. My name is David Iglesias. I am the director of the Wheaton Center for Faith, Politics, and Economics, and I am really excited about this evening event. We have an expert who has spoken in multiple venues all across the country and overseas about the American healthcare system. So thanks for coming. I can't read you this bio. It is extensive, but I'll give you highlights, and I hope Sally is okay with the highlights that I picked. So she is the president and chief executive officer of the Pacific Research Institute, based out of San Francisco. It's a think tank that was established in 1979. She addresses national and international audiences on the topic of healthcare. She's been on numerous news media, including ABC's 2020, CNN, Fox News, NBC Nightly News with Brian Williams, and many, many others. She writes a biweekly health column called Piping Up, which is a clever play on your name, for Forbes.com. She has written opinion pieces on the Wall Street Journal, the Washington Post, USA Today, LA Times, New York Times, and many, many others. She, and this warms my lawyer heart, she's participated in many debates. I'm sure she wins them. And here's an interesting aside. She was featured in Michael Moore's movie Sicko, if any of you have seen that. She's testified in front of Congress, both the House and the Senate. She's published numerous books. And let me just give you the names of a couple. Truth About Obamacare, Miracle Cure, How to Solve America's Health Crisis, Top 10 Myths of American Healthcare. And I do need to tell you, she is a former Canadian, but an American citizen now. Now, before I have her come up here and begin her comments, those of you that have come to FPE events know that normally I ask you to write your questions on a piece of paper and bring them up, and then I have to screen them. Not anymore. We are in the 21st century. If you have a question, please go to slido.com, follow the directions, enter your code V189. You can write your questions on this. They will appear magically later up on the screen, and Ms. Pipes will have an opportunity to read. And you can rate each other's questions. So my subjective judgment will be substituted by your subjective judgment. Without further ado, Ms. Sally Pipes.
Well, what I like to say about healthcare is it's similar to unraveling an onion. Many layers and many tearful moments. And I think many politicians hope that they don't have to talk about healthcare. They wish it would go away, but it is a very, very important issue. So I'm going to talk about, where we are with Obamacare, what my solutions are, and then end up with what I believe is the most frightening thing about our healthcare system right now, the siren call for moving to a single-payer Medicare for all system, which is at the national level and and in many states. The 2,700-page Patient Protection and Affordable Care Act was signed into law on March 23rd, 2010, so it's about to celebrate its 8th anniversary. And I was saying to Sally, I can't believe I've been fighting this for over 9 years, and I don't know, where does the time go? But every day there's something new, there's a new challenge, so I'm never wondering what I'm going to do next, and I'm never twiddling my thumbs. Not a single Republican voted for the Affordable Care Act, or what I like to call Obamacare. The law did survive 2 U.S. Supreme Court challenges. The first one in 2012, that is the one where the Chief Justice, John Roberts, had the deciding vote that upheld Obamacare, where he said that the individual mandate was a tax, and therefore Congress had the authority to deal with that. The second loss was in 2015, and so Obamacare survived another threat. But things are happening now, which I'm going to go into, and I think it's all very exciting. Prior to the law being passed on March 23rd, that wonderful person from San Francisco, Nancy Pelosi, who was the Speaker of the House at the time, she made this brilliant statement 2 weeks before. We have to pass this law so that we can find out what's in it. I mean, that was just mind-boggling to me. Well, the American people did find out what is in Obamacare: high premiums, high deductibles, small networks of doctors and hospitals, and little choice in insurance plans. It is important to note that under Obamacare, we have today about 11 million people covered on the exchanges, either healthcare.gov, the federal exchange representing 32 states and DC, or the states that have their own plans. But when you think about it, the Congressional Budget Office had projected that instead of 10 to 11 million people on the exchanges, we would have by now at least 24 million people. So it just goes to show, I'm a former econometrician, and I gave that up because I won some awards, but it was just a fluke. So, forecasting is very difficult, and as Yogi Berra has attested many times. So, the 85% of the people on those exchanges are receiving subsidies from the federal government. But it's interesting to me that for 10 million people, the United States healthcare system has been turned on its head for so few people. And when candidate Donald Trump was campaigning, he called Obama, you know how he always has these little phrases, well, it was disastrous Obamacare, which it is a disaster, but it was a perfect thing. And I think one of the reasons that he won the presidency was 2 weeks before the election, he spoke in Valley Forge, Pennsylvania, and he said, Obamacare is a disaster, and we, if elected, are going to repeal and replace the law. And so he was elected on November 8th, 2016, and he did promise to repeal and replace Obamacare. But it's interesting, even today, with the Republicans controlling the presidency, the House and the Senate, it has not been possible to fulfill the goal of full repeal and replacement of Obamacare. I think that several members, people who are running in the midterm elections this fall, might have a hard time winning because it was not possible to fully repeal and replace. So my little projection right now is that I still think that Mr. Trump, the Republicans may hold the House and the Senate in these midterm elections, but I'm going out on a limb. But you can call me back next year and we'll see whether I was right or not. I did win a few 25-cent pieces predicting that Mr. Trump was going to win the election. I didn't want to go too far out. 25 cents seemed like a good amount. The recent AP NORC poll has showed that almost half of Americans say that health care reform is their top domestic policy issue in this election year. In a recent poll by Morning Consult for Politico, the results showed that the Democrats and the media who waged that incredible propaganda campaign trying to convince the public that Obamacare's failures were the failures, including the high premiums, high deductibles, were all because of Donald Trump and the Republicans. Polls, however, showed that 68% of registered voters believed that former President Obama and the Democrats are responsible for Obamacare's implosion. The electorate isn't buying the line that Trump broke it propaganda. So there's some very positive developments that are happening right now, even though the law is still in place. The first one is in December, the individual mandate was repealed under tax reform. And that is interesting because, as I mentioned earlier, the US Supreme Court decision in 2012, which upheld the law, was because Chief Justice John Roberts said that the individual mandate was a tax and therefore it was constitutional. But the repeal of the individual mandate goes into effect on January 1st next year. Interestingly, 79% of those people who paid the tax penalty were people, about 7 million people, earning less than $79,000, less than $50,000 a year. So that mandate was really falling on people on the lower income brackets. So just on Tuesday, yesterday, the attorneys general of 20 states, 20 red states, starting with Texas and Wisconsin, they have filed a federal lawsuit in Texas claiming that the health care law, because of the repeal of the individual mandate, is now unconstitutional. So we'll see, there's people saying the case is going to go forward, some people are saying it's not, but it is interesting that this case has been filed. One note of caution, while the individual mandate on Obamacare has been repealed for next year, Many states are now saying that they're going to introduce their own individual mandate. Massachusetts, of course, has an individual mandate under Obamacare from 2006, but California, New York, Maryland are all talking about having their own individual mandate. So this is very worrying, but you know, in politics, things are always moving around. There's never a dull moment. The big question, though, is will Congress try to repeal and replace Obamacare this year? Well, Senate Majority Leader Mitch McConnell, he has said that we had 52-48 and we couldn't do it in the Senate, so I don't think it's going to be possible to repeal and replace with the 51-49 Senate. So he said, this was at the end of the year, I think we will move on to other issues. Senator Ted Cruz, on the other hand, has said this in January that we need to finish the job in repealing and replacing Obamacare. We promised the voters that. We have to do it. So he's hopeful that there will be another reconciliation bill brought forward, which would require 50 votes plus, of course, Vice President Pence. But we'll see whether he holds the day. There was a big, you probably saw this at the Greenbrier in West Virginia. There was the Republican Senate and House retreat, and the Amtrak train that they were on went off the track on the way to the Greenbrier. But I think it was the man in the garbage truck that drove through the barricade. But I don't think it wasn't a terrorist kind of thing. But Senator Thune said at the Greenbrier, where there was very little discussion of repeal and replace, it's all about infrastructure, the tax reform, all of these things. Thune said it would be a very heavy lift for us to repeal Obamacare this year using reconciliation. Senator Lindsey Graham, who along with Senator Bill Cassidy, they are still pushing for repeal and replace. They think that they want they have a bill where they want the feds to transfer funds to the states so that the states will have control over their health care. Everyone that I've talked to, from the Chief of Staff to Paul Ryan to Mitch McConnell's Chief of Staff, they all say this is not going to happen this year. So we'll see. Politics, things they say, change all the time. But in addition to the repeal of the individual mandate, there have been several other very exciting things that you've probably heard. They're junk insurance, sabotage, all of this. But a couple of things that have been really important in addition to the mandate are under the short-term spending bill. The medical device tax was delayed for a further 2 years, so that'll start in 2020. The Cadillac tax, which the 40% excise tax, which keeps being delayed, had been delayed till 2020, has now been delayed till 2022. I may not even be alive in 2022, so we'll see. Obamacare might not be around. Unfortunately, the HIT tax, that's the health insurance tax, that did go into effect this year. But on October 12th, President Trump signed 3 executive orders. They're all very, very important. The first one, which the rule has just come out a couple of weeks ago, which would allow insurers to offer short-term insurance plans for 12 months rather than 3 months. That was a cutback during Obamacare. So that is very important. Alex Azar, who's a good friend of mine, the new Secretary of Health and Human Services, he said allowing for short-term plans offers another choice for people who may not be able to afford coverage that has all of the mandates, essential health benefit mandates, under Obamacare. These won't be for everybody, but they do offer a choice. But the Dems are hysterical about this rule. There's 60 days for comment on the rule. Alex Azar said he thinks it will go through and that short-term plans would be available at the end of the summer, early in the fall. But the many Dems are hysterical, saying this is junk insurance, it's sabotage, all of these things. But offering people more changes is the way to solve our healthcare problem in this country. I don't know if you follow this. I follow this all day, every day, 7 days a week. So it's hard to keep up. But in Idaho, the state is going to allow short-term plans to be sold that do not have the Obamacare essential health benefits. They have not applied to HHS for a waiver. They're going ahead anyway, and the Blues are offering what they call Freedom Blue short-term plans. So Alex Azar has said he's not sure what's happening there, but he will be having discussions with the governor of Idaho and the insurance commissioner. So Idaho is, out there going alone, but the short-term plan executive order is very good. The second one, of course, was allowing association health plans. Many people that run small businesses, like I run a small think tank, find it's very difficult to get coverage, it's very expensive. So allowing the small group market for small businesses to band together, make a larger pool, they will be able to get insurance at lower prices, and that they would be able to organize these groups across state lines, which was, remember when President Trump was campaigning, he said, we've got to get rid of those lines. I thought, what lines is he talking about? Is it like lines in Canada for healthcare, the long waiting lines? No, he was talking about the state lines. But association health plans will be very good for people in the small business market. The third executive order has to do with health reimbursement accounts, which are part of employer-based coverage. And the good news there is that people would be able to use the funds in their HRA to help pay for their premiums. So those are three terrific executive orders that are really causing Obamacare to kind of implode, or as Mr. Trump said the other day, wipe it out. So the last thing is the following day, on October 13th, President Trump announced that CSRs were going to be would be ending effective immediately. For those who don't live the business, CSRs are cost-sharing reduction subsidies. These were illegal subsidies that the funds were never appropriated by Congress to pay insurance plans that covered the 6 million people earning between 100 and 250% of the federal poverty level. They were paid out for about 3 years, about $7 billion a year. But anyway, they have been ended. But of course, people like the bipartisan group, Senator Lamar Alexander and Senator Patty Murray, the Democrat from Washington State, they want to have a bipartisan bill, which they hope will come back in the new budget, which will allow the CSR payments to be reintroduced. I hope that doesn't happen. Several of my friends on the Hill say it's not going to happen. The insurance companies had already priced their plans for 2018, knowing that the CSRs were not going to continue. And one more thing that is very exciting to me is that under Medicaid, CMS, Centers for Medicare and Medicaid Services, SEMA Verma, announced that there was a new rule that would require work requirements for certain able-bodied adults. They would be required to work 80 hours a month. And so that is interesting, because a lot of people today on Medicaid are people who could work but choose not to because they get the Medicaid funding. Of course, there are a number of people on Medicaid who aren't able to work, and we're not talking about those people. Kentucky was the first state that applied for a waiver to include work requirements in that state, and it was granted by Centers for Medicare and Medicaid Services. Indiana has also received a waiver. 8 other states are doing so. I can tell you that the state I live in, the great state of California, which is kind of rolling into the Pacific Ocean these days, will not be applying for a waiver for Medicaid work requirements. So a number of people in the media said, well, if a state gets a Medicaid work requirement, such as Kentucky, lawsuits will be filed. And we've already seen that the Kentucky lawsuits have been filed already, because people think that it's not fair for people on Medicaid to have to work. Very few people realize we have a population of about 330 million in this country. Does anyone know how many people are now on Medicaid following the expansion under Obamacare? 76 million Americans are on Medicaid, the program for low-income Americans, people earning below 138% of the federal poverty level, which is about $37,000 a year. So in the state of California, 1/3 of our residents, 13 out of 39 million Californians, are on Medi-Cal, which is the name of our Medicaid program. So it's very, there's a lot going on in Medicaid, but it's not working for many people. Many of these 76 million people now on Medicaid, they can't find a doctor because the reimbursement rates for docs are 38 to 42%, below what a doctor gets for treating someone with private coverage. So they can't get a doctor, or they have to wait too long for an appointment. So one of Obama's goals was that we would, under Obamacare, emergency room use would go down. But unfortunately, because of that Medicaid expansion and the fact that these people can't get doctors, Medicaid use in most of the states, the expansion states, has already increased, and it's a very costly program. Governor LePage in Maine 5 times vetoed bills that came to his desk saying that they would expand Medicaid in the state of Maine, and he vetoed each one of them. But last November, in the election, an initiative was passed that said that they support the Medicaid expansion. LePage says he's not going to allow it, but we'll see what happens. He's term limited out. So, and a number of other states have said if they didn't do the Medicaid expansion at the political level, they're going to introduce initiatives, and Florida and Texas are 2 states that are talking about that. So the GOP Senate was unable to repeal and replace Obamacare. We had the House had passed the American Health Care Act on May 4th by a slim margin. And then we had 3 bills that were introduced in the Senate under reconciliation. Not one of them passed. And then in September, the same Senators Lindsey Graham and Bill Cassidy, they introduced their last-ditch repeal bill, but Mitch McConnell did not bring it to a vote because he said they'd already lost 3, and he felt that they didn't have the votes. So this is the idea. As I said, they're trying to bring it back for the budget in March, but it would take funding from the feds and give it to the states so that they could design their own healthcare systems. The problem is that in California, if the feds give California more money, what are they going to do with those funds? They're not going to say, well, we're going to get out of Obamacare. We're going to have single payer. So there's a lot of problems with the Graham-Cassidy bill, and as I say, I don't think it's going to come to pass. So I have to say that I believe, as does Mr. Trump, that Obamacare is in a death spiral. As I said, there's very high premiums that people can't afford, deductibles. If you have health insurance, but your deductible for your family of 4 on a silver plan is $12,300 before your insurance kicks in, you can't afford to use your insurance. You have insurance, but you can't use it. The premiums on the exchanges, remember President Obama said over and over again, if you like your doctor and you like your insurance plan, nothing will change. The average family would see their health insurance premium go down by $2,500 a year. Well, that just isn't the way it is. Premiums have been up every year since Obamacare came into being. 2017, the average silver plan increase was 24%. For 2018, 37%. And these premium increases are because of 2 things that you don't want to talk about, but community rating and guaranteed issue. So over the last 3 years, we've also seen many insurers get out of the insurance market. So the idea of Obamacare was there'd be a lot of competition and the prices for premiums and deductibles would come down. Well, in fact, many of the major insurers, United, Aetna, Humana, have got out of most of the markets. Anthem Blue Cross is out of a lot of markets. And there was a big worry last year that several counties in this country wouldn't have any insurer. At the end, several counties, but they have only 1 insurer. That is not competition. That is not what President Obama promised. We're seeing a lot with this repeal and replace not happening. Andy Slavitt, the CMS administrator under Obama, he's got a new thing called US of Care. That's the United States of Care, and he's trying to put together a bipartisan group that would promote bipartisanship and better health care for everyone. The problem is that the people who are on his group the Republicans that are there are not free market Republicans. And he said publicly that his ultimate goal is single payer health care. So this makes me very, very worried. And then, of course, you probably followed in the news the big 3, Amazon, Berkshire Hathaway, and JP Morgan Chase. They have all announced they have intentions to reduce healthcare costs and make healthcare affordable for their 1.2 million employees that are covered under their umbrella, and that this new company would be free from profit-making incentives. Now, it's interesting that all of these companies have made their money through the profit system. So, but now they say, but then they also said, but we don't come to the problem with any answers. So, well, that's interesting. You're going to reduce healthcare costs, but you don't really know. I think we all want healthcare to be affordable, accessible, and to be a quality plan, but you know, it's not as easy. And Walter Wriston, when he was head of Citibank, and Howard Schultz from Starbucks, which I enjoyed Starbucks coffees today in your student union building, they both tried to band together companies to reduce costs, and it didn't happen. One of the big issues is, in this country today, 177 million Americans have employer-based coverage. Most of them love their coverage. So if Bezos, Diamond, and Buffett come in and say, well, we've got this new idea, we're going to, you know, reduce the types of plans and what's in the plan, your employees are going to be very, very upset. So it's going to be interesting because that benefit, which of course never should have happened, but it happened during World War II when wage and price controls were in. So employers got to write off the cost of their health care, and employees get their health care tax-free. You lose your job, you go into the individual market, and you have to buy your health care with after-tax dollars. But the other point that I think is worthy of making is, I don't know if any of you students probably weren't alive in 1980, but in the 1980s, the HMO, the Health Maintenance Organization, came into being, and that was a way to reduce costs for employers. So companies all had, oh God, we've got the HMO, it's fantastic, we're reducing costs. Well, employees rebelled against the HMO, and by the 1990s, basically HMOs were dead, and PPOs became the way because employees were so upset. So we'll see as this unfolds with the big three, what they're going to be able to do. If the costs of putting their program together are more than the benefits that they're going to save, it's going to affect their profits, and they're going to be going like, well, I think we better run away from this. But it is true, the American public made it very clear in the November 2016 election that Obamacare was a central issue, and they wanted it repealed and replaced. Just a few facts. We spend 18.2% of our gross domestic product on healthcare, more than any other country in the world. But America is a wealthy nation, and we want the very best in healthcare. I'll talk a bit about Canada, where I'm from, where we spend 11.2% of our gross domestic product on healthcare. But that's what government's prepared to spend: long waiting lists, ration care, and lack of access to the latest technologies. The American Association of Medical Colleges, and we were talking to Dodd about this at dinner tonight, said that by 2030, there will be a shortage in this country of 104,000 primary care doctors. Many doctors are quitting medicine or retiring early because of mandates and regulations under Obamacare. And my husband's doctor, who he loved, he was a PhD and an MD, received a letter last Friday saying, unfortunately, I'm shutting my practice on March 15th. I'm going to continue to do my research, but because of the mandates and regulations and the fact that my income has been reduced under Obamacare, I'm getting out. This is not a single thing. This is happening all over the country. And what does it mean for the brightest kids going into medical school? We've already seen a reduction in the MCAT scores of kids applying to medicine. And particularly if their parents are doctors, they say, you don't want to go into that. It's very difficult, and you won't be able to practice the kind of medicine that you want to. So President Obama had two main goals: universal coverage, bending the cost curve down. He wasn't able to accomplish either of them, and the Congressional Budget Office said by 2026, 28 million Americans will still be uninsured. So we have the federal exchange, the state exchanges, but many states joined those, healthcare.gov, the federal exchange, because they lost so much money they couldn't afford to continue to run their own exchanges. To make Obamacare work, the president and the administration said, we will need 40% of our enrollees to be the young invincibles. Now, there are many young invincibles here. I am not a young invincible anymore, but for those between the ages of 18 and 31, you are the young invincibles. They said 40% of the exchange market had to be these young invincibles in order to cover the costs of people who are older and sicker, my generation. Well, it turned out that only 26% of the enrollees fit the young invincible group. And so insurers were losing a lot of money because they had all of these older, sicker people, but they weren't being covered by the premiums from the younger people. Many of these young people decided to pay that individual mandate, $695 or 2.5% of income, whichever is greater. If you're a young person like David and you're 28, 30, you're starting out, you're dating Cynthia, you don't want to spend $400 a month on health care. You'd rather pay a $695 penalty and just take a chance on it. And that's why so many young people did not sign up, and why the insurers in the exchanges lost so much money. I have a plan. It's called my book, The Way Out of Obamacare, which came out in 2016, which is a program to get out of Obamacare. I want to empower doctors and patients, not the federal government. I'd like to change the tax code so that in the meantime that individuals who can't write off the cost of their health care, they could then do that until we get mobilized, because we really want to get employers out of the insurance market. I mean, we don't get our car insurance, our home insurance, our long-term care insurance from our employer, but that was a gift during World War II when wage and price controls were in. Employers offered people like us this health care as a way to get around hiring new people or keeping people when they couldn't offer them a salary increase. So the tax preference thing is one of the biggest problems in our healthcare system. We also, with the employer-based model, have what we call first dollar coverage. Most people who have employer coverage have no idea. They may pay a small copay, they may pay a small deductible when they go to the doctor, but they basically think it's provided by my employer and it's basically free, so I can go as often as I want. I can demand an MRI when I've got a little twitch here. I can, want an x-ray of my hand when I've got a callus. All of these things encourage people to use more health care than they really need to. So that is a big issue. Medical malpractice is a big issue in this country. Remember when Obama was campaigning and he brought out some doctors and he said, and little pill bottles, the red pill, the blue pill, these are just overpriced, and doctors are doing all of these tests because they want to line their pockets with a lot of money. Well, the issue is doctors do a lot of medical tests because they are afraid of being sued. The cost of medical malpractice insurance in the United States today, according to PricewaterhouseCoopers, $210 billion a year. It's very, very expensive. And a lot of docs who were neurosurgeons or OBGYNs actually got out of the practice of medicine if they were in the small group market or they were single practitioners because they couldn't afford the coverage. The average GP, primary care doc in this country, earns $215,000 a year. If you have med-mal insurance at $100,000, you've got other things to pay for, taxes included. So it's something that really needs to be reformed. We need to redo Medicaid so that we block grant the states. Medicare came into being in 1965. They both came in 65 July under President Johnson. The average American lived to age 65 back in 1965. Today, the average American lives to almost 80. And so, we've had a lot of pressure. Medicare Part A, the hospital part, could be bankrupt by 2030. That's what the Medicare trustees say. And so, why should someone like Warren Buffett be eligible for Medicare? He doesn't need it, but there are a lot of people that do need it. Medicare and Medicaid should be there, these programs, for the people who really need them, and not for people just because they paid into it. They should be able to get it. Health savings accounts put patients back in charge of their health care. 21 million Americans today have HSAs, and they are working extremely well. And I would like a new law that would allow people who have money in their HSAs to use those funds to pay premium and deductibles, and also to increase the amount of money you can put into your HSA each year. Right now, it's $3,450 for an individual, $6,900 for a family, but they could be a lot higher for people that want that. So those are some of the things that are in my plan. If you want, you can go online and buy The Way Out of Obamacare. My new book will be out on March 6th. It's called The False Promise of Single-Payer Health Care, and I'm just going to spend a few minutes talking. How many minutes do I have? left? 5 minutes. Okay. Well, single payer, Medicare for all is the siren call. As I said, repeal and replace didn't happen, but Bernie Sanders, I call him the Pied Piper of single payer healthcare, sort of a play on my own name, but he is the Pied Piper of single payer healthcare. Remember in 2016, he was debating Hillary. He had his Medicare for all plan. He wouldn't say what it was going to cost or how it was going to be paid for. There would be no private insurers. There'd be no Medicare, no Medicaid. Dental would be covered. Vision would be covered. Long-term care, drugs would be free, and nobody would have to get a referral to see a specialist. So, but interestingly, the Urban Institute, which is not a conservative institute, went out and figured out what his plan would cost, and the cost was $32 trillion over 10 years. That's $3.2 trillion a year, which would double what we're spending in the whole on healthcare today. So he, of course, didn't get the nomination to be president, but he has been on a roll, going to Canada, telling Canadians to scream out for single-payer healthcare, all of these things, because he's such a zealot on it. People don't realize, and I'm going to talk in a couple of minutes about what Medicare for all really means. Being Canadian, I started a research project back in 1988 called Waiting Your Turn, A Guide to Waiting Lists in Canada. In 1993, as I mentioned, Canada spends 11.2% of gross domestic product on healthcare. In 1993, the average wait from seeing a primary care doc to treatment by a specialist, 9.3 weeks. That's 2 months. Today, last year, 2017, the average wait from seeing a primary care doc to treatment by a specialist, 21.2 weeks. 63,000 Canadians come across the border each year to get an MRI, a PET scan, a hip surgery, heart surgery, whatever. Just look in the Detroit papers or in the Ontario and Quebec papers. They all advertise you can get an MRI in a day in Detroit or in Chicago or wherever. But these waits are very harmful to people's health. And single payer is not free. The average Canadian family in their tax burden pays $12,500 a year for this health care, which they have to wait for. The average MRI wait in Canada today, 11 weeks. For neurosurgery, 33 weeks. There are 950,000 Canadians are on a waiting list just trying to get a primary care doctor because so many docs have quit medicine. So we really have to think about, is this what we want? In California, we passed last June 1st, SB 562, single payer bill. It was like the same as Bernie's, cover everything. Nothing would be private at all. And the Assembly Speaker, who's a Democrat, actually parked the bill. But the cost of it, according to the Senate Appropriations Committee, Democrats, $400 billion a year. So a professor at Amherst, at UMass Amherst, said, oh no, $330 billion. The total budget of California is $185 billion. This is just huge tax increases, all of these things, and all these politicians have had to say, well, we'd have to have huge tax increases, income, payroll taxes, and all these things. We do not want a single-payer healthcare system in this country. We want a program that will allow patients to have affordable, accessible, quality care through some of the things I've talked about. If we get a single-payer system in this country, we will be on the road to serfdom, and there will be no off-ramp. So my job is to educate Americans, because most Americans don't know. And in Britain, if you read the British papers, every single day, catastrophes under the National Health Service, which started in Britain in 1948. Canada copied it, but they didn't allow private insurance to run parallel. People are being urged to go to Calais to get healthcare treatment, take the Eurostar, because the lineups, the long waits to get into the National Health Service are just out of control. So is that what we want for Americans, to have these long waits, to not be able to get good care? In England, a primary care doctor's average salary is $121,000 a year. That's compared to the $215,000 here. And the fact that they had to get rid of the times that you were only going to be allowed, the targets for waiting to get into an emergency room, they had to get rid of those. They tried to get doctors to come from overseas countries. They advertised for 600. They only got 100. So It's a catastrophe. So we want people to be empowered to do their own health care, and we want to give people opportunity. So we don't want to be on a path, on a road to serfdom. We want to have a healthcare system that makes us all live longer and healthier lives. Thank you. Now for the technological undertaking for the questions.
So please go on Slido and post your questions. We do have some, and we're going to put them on the screen so we can see what the top questions are.
Okay, is that the first one then? Do you believe healthcare is a human right? No, I do not believe healthcare is a human right, nor is it a privilege. In America, we have the right to life, liberty, and the pursuit of happiness. How do you determine how big that right would be? Should everybody have free food, free housing, free health care? All of these things, how do you determine how much of all of these things you do? It is not a human right. We have the option to get health care, but not by mandating it. What is your opinion of HSAs? Are they successful, and will they be? Well, I mentioned that 21 million Americans have health savings accounts today. I would like to see that $3,450 limit for an individual and $6,900 for a family be increased. I would love to see, and this was in one of the Senate bills, allowing people to use their HSA to pay their part of their premium or all of their premium and their deductible. That would really be helpful to a lot of people who say they can't afford their premium. Even people, there are a lot of people who are in that situation. What is the most important measure? Well, I think the most important measure that just happened was the repeal of the individual mandate, which, as I said, starts January 1st next year. That is really the beginning of the full implosion of Obamacare. And so I think that is very important. There's some other things. I mentioned the executive orders. And Alex Azar has a number of things that he is planning as Secretary of HHS to do, because as Secretary of HHS under Obamacare, there are 1,442 places in the law where the Secretary may or the Secretary shall. And so I think we're going to see a lot of changes, but offering people choices such as the association health plans, the short-term plans, people being able to use their HRAs. These are all things that open up and give people more choices. What can insurance companies and hospitals do to improve health care? Well, I think one of the things I mentioned is I'd love to see the tax code totally changed ultimately so that we don't get our health coverage through our employer, as 177 million do now. And so insurance companies, they negotiate rates with different companies, and if you're an individual, your rate is probably going to be higher because you don't have the power of getting together as a group. But insurance companies need to, I think, become more transparent and open in what the plans are. It's very complicated, and so we need to make it more transparent. If you call up, if your doctor says you need a hernia repair, and you call up Cal Pacific Medical Center and say, I have an HSA, how much will that be? I mean, you might talk to 10 people, nobody has any idea. We do need to work towards transparency. Do you think healthcare is more of a social issue? No, I think it's an economic issue. But we all need to have the opportunity to get the best healthcare, because at some point in our lives, we all need healthcare. Of the 76 million are children under 18. Well, under Obamacare, kids could stay on their parents' plans till age 26. Now, I don't know about you, but when I reached 26, I was kind of out on my own. I would never have, I lived in Canada, but I would never have thought that I should be covered, even if I were married, covered by my parents' plan. On Medicaid, there's Medicaid and then the CHIP. The CHIP program was just reauthorized for another 10 years. On on the kids staying on the plan till 26, there were about 4 million that did that. So could you speak? Oh, sorry. Yes, a private insurance system would lead to lower costs of treatment, because when you have competition, as Milton Friedman always said, you have more competition, the price will come down. Right now, we really have two payers in this country. One is the government, they're a third-party payer, and the other is private insurance. But if we had more competition, more types of plans, then we would see different things and different prices, and people would be able to get the kind of insurance that they need, and it would help. It would definitely help to bring the price of care down. Hospitals, you know, under this plan that just came out on Friday from the Center for American Progress, the Democratic think tank founded by John Podesta, you know, they've got this new plan called Medicare Extra, which everybody would be in Medicare, and they have auto enrollment, so in a couple of years all newborns, anyone 65 would have to join Medicare. Private insurance would be outlawed, but they said employer insurance can stay, but docs and hospitals would only be paid the rates that Medicare pays doctors and hospitals. So, you know, the hospitals aren't going to be pleased, and doctors, as I've talked about, would not be pleased. But, you know, there's a lot of hospitals, there's a lot of stuff goes on with the 340B program, which is a drug discount program, and the hospitals have kind of taken advantage of that, and there's a lot of fraud and unnecessary spending going on there. The polarization. Yeah, the polarization is huge. And, you know, there's a chap that wrote in the Harvard Political Review, Will Embry Moore, who said 5 years ago, the idea of Medicare for all, single payer, was just a pig in the poke. Nobody talked about it. It was just is considered completely off the radar screen. Today, as he said, 2/3 of Democrats, 15 Democratic senators, most of the members of the House Democrats are all in favor of single payer. So, you know, we've really seen a change in that. And as my friend Doug Holtz-Eakin said, for those people in the market who believe in market solutions to healthcare problems, we have to realize that single payer is out there. Bernie Sanders is mobilizing a lot of people, and he's not the only one now. The Center for American Progress is. And then in the states, California, Vermont, Bernie Sanders' state, if you remember, Governor Shumlin signed into law in 2011 a single payer bill. In December of 2014, he had to pull it from the books because he's a Democrat, but he said, I don't know how we can increase taxes so high that we could do this. So he pulled it. In November of 2016, Colorado had a single payer initiative on the ballot called Amendment 69. And John Hickenlooper, the Democratic governor of Colorado, urged the voters not to vote for single payer because it was going to more than double the budget of Colorado. And of course, it went down 80-20. So there's a lot of movement. Rhode Island now has got a bill for single payer. New Hampshire is looking at one. Massachusetts. This is a huge issue that people like myself have to educate people on why the complete government takeover of healthcare will just be like in Canada. Money will be limited. The supply of doctors will be down. Doctors will get out of medicine, and we will have long waiting lists. Care will be rationed, and we'll have lack of access to the latest innovation. The reason that all of the best drugs in the world made by European companies like GlaxoSmithKline, Roche, Schering-Plough, all of these drug companies, they do their R&D in America because there is a chance that you will get a drug passed. It's very expensive. Most drugs, only 1 in 10 drugs ever even makes it to the FDA, but America allows innovation, R&D. In these other countries, they all have price controls on their drugs, and so there's very little R&D that goes on. We want to continue to allow America, for companies to make the best drugs. For every $1 spent in a newer pharmaceutical, you save $7.17 in hospital costs. So we want to keep this business alive, but you know, under Bernie Sanders' plan, under the new Medicare Extra, They all want to put price controls on pharmaceuticals in the US, which will really destroy the market for innovation. Assuming it would. Oh, so the components of the replacement bill would be the things I talked about. You know, changing Medicare and Medicaid, Medicare allowing, increasing the age, allowing premium support through vouchers, means testing of Medicare, block grants for Medicaid, allowing health opportunity accounts so that some people on Medicaid could actually go out and get a plan and not have to be subject to the humiliation of not being able to get a doctor. Getting rid of the employer mandate, the individual mandate, doing medical malpractice reform, allowing people to purchase health insurance across state lines as they can under the new executive order on association health plans. So those are some of the things. We want to empower doctors and patients, not the government, in determining what kind of health care we will get, how much it'll cost, and who has access to it. Are there any positive sides to Obamacare? Well, I really, when I do national radio and people call in all over, people will call in and say, I bought the platinum plan, the most expensive plan there, and I'm paying a lot. I'm paying, $1,200, $1,400 a month. I call up my doctor and say, I'd like to make an appointment. And they say, well, do you have insurance? Yes, I have the platinum, plan, covered California, whatever it is. And the nurse would say, well, we don't take those plans. This has been one of the biggest problems for people who bought exchange coverage, finding out that the networks of doctors and hospitals are so small that most of the time their own doctors and hospitals aren't in network. And it's been very, very traumatic for a lot of people, even if they bought the platinum or the gold exchange plans that are expensive. So the goal of universal coverage and bending the cost curve down are laudable goals, but neither one of them happened under Obamacare. And when you have people upset with the premiums and deciding, not to get coverage because it's too expensive, or deductibles that you can't afford to use your plan, these are all things that are devastating to American people and are not in the interest of the kind of health care that we want. My dad is family practice. Do you predict hard times for him if Obamacare? Yes, as I mentioned, my own husband's doctor got out of the practice of medicine because of lowering of the payments they get and the tremendous amount of work in doing the electronic health records and all of the paperwork. So I think a lot of, as I said, the American Association of Medical Colleges said 104,000 docs will be out of the practice of medicine by 2030 because of these issues. The best and the brightest will not go into healthcare. Now, people keep saying you live in the evil state of California. I must say the weather is beautiful, but the way the government has gone, it's a disaster. But a lot of people say to me, well, why doesn't California then get its single payer bill and then all the other states will be rid of that? Well, that sounds like a great idea, but as you know, government programs move kind of slowly. And so it would be probably 4 to 5 years before the problems come up. By then, many states would have gone for single-payer health care. And so, but assuming if California had single-payer, first of all, a lot of docs would leave and go to Nevada or Texas where the market is better for them. But the best and the brightest kids graduating from medical schools or medical specialties would decide not to come to California to practice medicine. And that's a disaster for the people of California. Bundled payments, I'm not a big fan of bundled payments, and a lot of doctors are not big fans of this bundled payment system. Value-based healthcare, all of these things, are big things to be talked about, but they have not reduced costs under the ACOs, the accountable care organizations that have been set up, these test ones. They've had bundled payments for people on Medicare, and they haven't reduced costs, and they've made doctors extremely angry. Is there any hope our healthcare system will have transparency in pricing for consumers? I think so, and when you have more competition, there will be more transparency. I mean, when you go to a hotel room, often they'll say, they'll have the price chart on the door and say, well, this room is $200. You think, well, I only paid $100. Well, there will be price transparency when people demand it and when people take control of their health care. Like under HSAs, so many people, they call up, they want to know. And if your doctor says you need an MRI, and then he says, well, we have a MRI unit downstairs. Well, you say, well, are there any other MRI clinics around here? Well, yes. And you can go and shop around. People should be able to shop around for the best deal for them. And that will bring about price transparency. So the infant mortality issue, that's in my new book coming out. The problem with the infant mortality stats is that other countries do not call a live birth in the same way that we do here in America. Many countries determine a live birth by the number of days the child has lived and the weight of the child. We in America have the very best neonatal units. A lot of babies that would never be counted a live birth in France or in Germany or England are live births in this country. So you have to be very, very careful when you're talking about statistics. Milton used to say, statistics are a lot like sausages. You like them a whole lot better if you don't know what went into them. And so, that is one of the big issues. So there was a gal in Calgary, Alberta, and Alberta is Canada's most free market province. She was expecting quadruplets, and she was going into labor. There wasn't a single hospital in Calgary, in Edmonton, or in any of the neighboring provinces that could take this woman to deliver. They didn't, and they didn't have the kind of neonatal units as necessary. She was flown, airlifted to Montana, delivered her quads, and they survived and doing very well. And this couple, who was originally from South Africa, came back and said to the media, Canada's healthcare system is that of a third world country. And that's what we're hearing in Great Britain. A lot of the docs are saying, we are practicing third world medicine now because of the National Health Service and the government control. You mentioned you don't believe it even properly appropriated CS. Well, as I said, the Congress never approved the cost-sharing reduction program, a subsidy program. It was the costs are about $6 to $7 billion a year. The insurance, it really was a payout to the insurance companies, and so I think they should be pricing their product, according to what it should be. And those CSR payments were wrong and they were illegal. And if the Congress wants to vote on it and bring them back, that's one thing. But you can't. I think Donald Trump was correct in ending them because they were illegal. As I say, if Congress wants to vote on them and bring them back, well, then that would be the will of the people because members of Congress represent us. Is the existing private healthcare system in the U.S. working for the poor? Well, no. I mentioned that the people earning below 138% of the federal poverty level are on Medicaid. We have 76 million people on Medicaid today, and you'll read stories in the paper about the dental, children dying. They can't get to the dentist on Medicaid. That people cannot get doctors. They've long waiting lists, and so they're using emergency rooms. So it's not working. We need people to have that are lower income. We need to have different types of plans, but having 76 million people on Medicaid is not working. And one of the things that big issue is that people say, well, if we don't have Obamacare, people who have chronic or pre-existing conditions are going to be thrown out, under the bus. Well, Tom Price, when he was a member of the House, he became, for a short time, Secretary of HHS, and Paul Ryan, Speaker, this is part of my plan too, is the feds, if they want to do one thing, as I told you, there are only 9 million people on the exchanges. We've turned our whole healthcare system upside down. Ryan, Price, and myself believe the feds, if they wanted to do something, could put funds, 2.5 billion a year, into the state's high-risk pools so that those people who have pre-existing and chronic conditions could actually get good coverage and care, and it takes the pressure off the younger people who have been having to support the older and sicker, and why so many of them never signed up, the young invincibles, for exchange coverage, because it was so expensive because of these people. So high-risk pools is another important part, and I was meeting with Paul Ryan's chief of staff in Washington 2 weeks ago, and he said this is something, there's not going to be a repeal and replace bill coming forward, he's sure, but one of the things that might come forward would be funding for the high-risk pools, and in return would be payments for cost-sharing reduction subsidies. But anyway, I don't know if that's going to happen, but I think that is one way to solve it. It would be so much cheaper to help there are about 6 million people in this country who have chronic or pre-existing conditions who are in the individual market. It'd be so much cheaper for us to give these people the kind of funding and plans that they could buy that would be so much, it would be so much cheaper. And these people, 6 million people is not a lot of people. Or we could even pay for their coverage. It would still be cheaper than what we're doing now. Well, the percentage of expenditures relative to GDP has decelerated. Well, that's just not true. It's up 5% this year over the previous year. We're spending about $3.2 trillion. The Congressional Budget Office has said by 2025 we'll be spending 20% of our gross domestic product on healthcare, and it has not resulted in a decline in healthcare costs. Is rationing ever really? Well, I mean, if we have a better working market system, there will be more doctors who come into practice. We have to get rid of some of these certificate of need laws and things that, you know, keep the number of doctors down. But if we had more doctors and more, where's that question? Anyway, rationing, you know, of course, there's rationing in everything we do, but when everybody has access to care, 50% of people in America the government is funding their health care through Medicare for 65 million seniors, Medicaid for 76 million low-income people, the Veterans Administration, that is a single-payer system. Everyone's read the horror stories about our vets not being able to get they're in queues, they're in waiting lists, they're not able to get the access to the latest drugs that are on the formularies. There's been all of this negative views of what is a true single-payer system. And then the last one is CHIP. So we do have an incredible system in this country of government-run healthcare. As I say, 50% of our healthcare is in the hands of government. And you know, I'd like to move more to a market-based system, so some of the people on Medicare and Medicaid, those programs would be there for the people who truly need them and not for a lot of people that choose not to work because they can be on Medicaid and they can use opioids. There's a correlation in several of the new studies have come out that said in the states that expanded Medicaid, opioid use is up in those states and these people aren't working. So MACRA, I'm not a big fan of MACRA. A lot of docs aren't. And I think Alex Azar, they've postponed the MACRA guidelines for the next, I think it's the next year. Why do people and politicians continue to call the ACA Obamacare? Because it was Obamacare's signature issue, and he ran on it, and that's what he wanted to be. Many Democratic presidents before him had tried to, you know, get an Obamacare kind of legislation, and the ACA is really the Patient Protection and Affordable Care Act, and it hasn't protected patients, and it hasn't become affordable. So Obamacare is easier because it was his program and his plan. What are my concerns about single payer? Well, I mentioned them. Long waiting lists. If Canada, you have to wait 21.2 weeks from seeing a primary care doc to getting treatment by a specialist. Care is rationed, and you don't have access to the latest drugs and treatments. Those are things that the American people, my mom, before she passed away, and actually my mom passed away from colon cancer in Canada. She was a senior. She thought she had colon cancer, but because she was a senior, she was told that she could not get a colonoscopy because there were too many people below 65 on waiting lists to get colonoscopies. She finally, in November, got a colonoscopy because she went to the hospital, was hemorrhaging. She spent 2 days in the emergency room, 2 days in a transit lounge waiting for a bed in a ward, and she got her colonoscopy, but died 2 weeks later from metastasized colon cancer. You can control costs by denying care and starting with denying care for our elderly. So Telemedicine is a great idea. There's a lot of, a lot of rules and regulations that are against telemedicine, but there's some good companies out there doing some really good things, and I think it's going to be, the voice of the future. A lot of docs don't want to prescribe or diagnose over the phone, or over email. But I think in this day and age, computers are important, and it's not solving everything, but I think telemedicine is a good invention. Well, a lot of the underlying pushing down the cost of healthcare will be reducing these mandates. As I said, under Obamacare, there are 10 essential health benefits: preventive care, free mammograms, free prostate exams, free maternity training, all of these things. And then on top of that, every state has between 40 to 49 mandates on an insurance company, whether it's, I was saying it at dinner, I mean, if I want a healthcare plan that covers alcohol rehabilitation, I know this is an alcohol-free campus, but if I want a plan like that, I should be able to go out and buy it. But why should David have to subsidize a plan that I want? Now, if Dot wants in vitro fertilization, she should be able to go out and get a plan that covers in vitro fertilization. In fact, in California, Massachusetts, in vitro fertilization is a mandated regulation. And so those IVF is about between $10,000 and $20,000 per person. But if you want a plan that covers that, you should be able to get it. But I shouldn't have to subsidize you having a very expensive plan that I don't want. So these are some of the things that are, what are your goals? Well, my goal is to get rid of Obamacare, repeal and replace Obamacare with the things that I outlined in my plan, allowing people to buy coverage across state lines, getting rid of the employer, the tax write-off that employers get and that we as employees get, changing med-mal reform so that doctors can, neurosurgeons and obstetricians who are in private practice don't have to pay these exorbitant bills because they're afraid something will happen, so they practice defensive medicine. Changes to Medicare, changes to Medicaid, bring them in line with the 21st century. Because these plans, when Lyndon Johnson brought them in, he said, if there had been a congressional budget office that could have costed out these programs, we never would have got it through. And so, in fact, in 1965, when Medicare came into being, it'll be 53 years old this July, when it came into being, it cost $3 billion in the first year. The people that worked with Johnson in the economics department, as I say, they didn't have a CBO. They forecast that Medicare would cost $12 billion by 1991. In fact, Medicare in 1991 cost $110 billion. No government program ever costs what government says, and that's just the same thing with the premiums and the deductibles under Obamacare. They were much, much more expensive, and they didn't reduce the cost of care. Excuse me. What an increase in income. Well, it is difficult. As I said in the beginning, understanding healthcare is similar to unraveling an onion, many layers and many tearful moments. And when I get calls from people who tried to sign up on Covered California, and you take a look, it's really daunting. You actually have to have a PhD in economics to figure out, if you're in the individual market, what kind of plan, what the plan covers. It's very, very hard for people to figure out. Let's make it simple, and it would be so much better. Do you believe that healthcare is a normal good? What people consume it more as their income? Yeah, I think that people probably do, because a lot of people I know who, are middle income and upper middle income, they have time on their hands. They like going to the doctor. They want a new diet. They want this. They want that. People want more as their income rises. So thank you all very much.
Thank you so much for your time.